And hypertension, also known as high blood pressure, once considered a disease of the elderly, is now increasingly affecting young people. This trend is alarming, and experts warn that if left unchecked, it could have severe consequences for the country's health and economy. Sarah Penkro has more in the following report.
Hypertension or high blood pressure remains a significant public health concern in Ghana, affecting roughly 1 in 4 adults. Sedentary lifestyles, poor diets, and increasing stress levels are all contributing factors. Studies suggest with less than 35% of individuals aware of their condition, only about 22% of those diagnosed are receiving treatment. Gina is in her 30s and has been diagnosed with high blood pressure, but she has her own plans for treatment.
Somewhere around last year, November. One time I was there in the afternoon, I started feeling severe pain all over my body. Very severe headache. I realized I was getting weak. I started going to the pharmacy to check. Every time I check, it gets very high. Sometimes when I go, it's medium or it's low. I did that for almost 2 weeks and I realized it's not stable at all. So I had to go to the doctor. So he told me that he would like to put me on drug, and I said no. And that I would want to manage it myself because I wouldn't want to start dragging myself from now. Once it started becoming severe, I take anything like a paracetamol, I get okay. So there are other herbs I've been taught to be doing, some minor teas I do in the morning and maybe before bed too. So
Gina tells me that knowing her triggers is her way of taking control of her health.
Checking it all the time, realizing it was not becoming stable worries me a lot. So for about 3, 4, 5 months now, I don't go checking. I don't want to put myself on the beat of a cold, so I stopped the checking and then I'm managing it, I'm okay. Even yesterday, I had some kind of headache, so I had to take some paracetamol and then go to bed and sleep early, and that was all. I'm getting used to the fact that it's becoming high and you have to go on the drug, and I don't want to continue with the thought, go and take the medicine.
It is a growing concern quietly creeping into the lives of Ghana's youth. Interestingly, many are unaware of their blood pressure status.
To check for BP, no.
Why?
Because I presume I'm okay. Almost 15 years. I check if I'm in hospital,
About 5 years.
Others, though aware of the consequences, remain unbothered.
I think the last time I checked was 2021, and it was normal, but ever since then I've not been bothered to check my BP again.
That was last year, April. It was okay. Yeah, because my boss was admitted at UG Hospital, so I took opportunity to also check it.
The danger is that uncontrolled hypertension can lead to serious health complications, including heart disease, stroke, kidney damage, and death.
Among the youth, it is common, especially in the 30s, going to 40s, very common in that age group. And it's particularly more common in men. For everybody, a regular check is helpful, just to be sure that the BP is not going up, because it doesn't give any sign. But if you can live a healthy life, take a lot of fruits, rest when you should, take a lot of fluids, avoid abuse of pain medications, then your risk of getting hypertension is very low.
The economic burden of hypertension is also significant, which can undermine the country's development.
When you develop hypertension in pregnancy, you may be put on medication in the course of that pregnancy. That type of hypertension, when you give birth, can disappear completely. But you need to check, especially after 6 weeks of giving birth. Other than that, all other forms of hypertension, unless it is a secondary hypertension, the hypertension is due to some condition, and we have treated that condition, the hypertension has disappeared. But essential hypertension, which is that there is no known condition or cause to the hypertension, you will most likely be on medication for life. No one should ever stop a hypertension medicines without consultation. Even when you feel, some people look at how they feel a day, that when I take the medication, it's even making me worse. When I don't take it, I'm fine. I checked 2 days without taking the medication and it was low, and therefore I stopped. No, That is dangerous.
Gina is just one of the country's many vibrant youth battling hypertension. It is very important to check your BP regularly and note your status. Sarah Apenkro, TV3 News, Accra.